Welcome, and thank you for joining us today. The USC Family Caregiver Support Center is pleased to provide this educational video for families and relatives who want to learn more about legal and financial planning as they take care of one or more loved ones. Today's topic will address Medicare insurance benefits. I'm Jenny Peterson, and I will be your host for today's program. I'm here today representing the USC Family Caregiver Support Center, which serves and supports family caregivers as they navigate through their caregiving journey. The center provides services such as information and referral, support groups, evidence-based trainings, community education, and much, much more to family caregivers seeking help. We like to think of ourselves as a valuable lifeline and important resource for family caregivers. Our center is also home to the Los Angeles Caregiver Resource Center, which is part of the California statewide system of 11 caregiver resource centers. Now, if you happened upon this video by chance and you don't know about our center yet, please visit our website at www.fcsc.usc.edu for more information. Better yet, you can even sign up for our program right on our website through the yellow CareNav tab on the right-hand side of the page. Family caregivers need support, and our center is here for you. Today's presentation will focus on Medicare insurance benefits. Living in California, we probably hear more about Medi-Cal than Medicare. But the truth is, both of these programs are key parts to the insurance benefits available for the person you are caring for. Understanding how Medicare and Medi-Cal work together can assist families in making the most out of their loved ones' insurance benefits. Joining us today is Stephanie Denning from the Center for Healthcare Rights, a nonprofit organization which helps and advocates for LA County residents to use their Medicare and Medi-Cal insurance benefits to their full potential. Ms. Denning is the Senior Program Manager and Staff Attorney for the Center for Healthcare Rights, and she's here to talk about how to navigate Medicare benefits and coverage. Stephanie, take it away.
Hi, thanks so much for joining. Today we're going to be talking a little bit about navigating Medicare. My name is Stephanie Fahuri Denning. I'm the Senior Program Manager and Staff Attorney at Center for Healthcare Rights in Los Angeles. So today, we're going to talk a little bit about navigating Medicare benefits and coverage. I understand that this is a very complicated topic, so I'm going to do my best to really lay it out as clearly as possible. Next slide, please. A little background about Center for Healthcare Rights in case you're curious about why I'm the one presenting today. So Center for Healthcare Rights is Los Angeles County's Medicare counseling agency. We are referred to as HICAP, which stands for the California Health Insurance Counseling and Advocacy Program. If you call 1-800-MEDICARE, they might try to refer you to a SHIP counselor. That's also us. So we are a nonprofit advocacy organization. We provide free education and help with Medicare and other related health insurance for Medicare beneficiaries in Los Angeles County. One of the great features of our program is that we do one-on-one consultations and provide educational presentations like this one. But if you have questions that come up about your Medicare eligibility, Medicare coverage, benefits, costs, any of those things, after today's presentation, please feel free to give us a call to set up an appointment to speak with a registered Medicare counselor. Our phone number is here on the slide. It's 1-800-824-0780. And you would set up an appointment to speak with one of our counselors about any sort of Medicare-related question. We also have a number of educational materials and resources on our website, which is www.healthcarerights.org. Next slide, please. So today's presentation is going to cover a number of topics. So first, we're going to talk a little bit about Medicare eligibility, enrollment periods, and benefits. What does Medicare even cover? And then we'll talk a little bit about costs in 2021. Some of those will likely change for 2022, but those numbers don't get released until later in the fall. Then we'll move on to financial assistance programs for low-income Medicare beneficiaries. We want to make sure that everyone who's eligible for financial assistance can figure out a way to qualify. So that's something that our agency also helps with. And then we'll finally wrap up with options for supplementing Medicare because, as you'll learn, Medicare doesn't cover all of the costs and it doesn't necessarily cover all of the benefits that you might want to have covered. So lots to talk about today. So I guess let's dive in. So first, what is Medicare? I know that there's a lot of confusion because Medicare and Medi-Cal sound very similar, but Medicare, what we're going to be focusing on today, is a federal health insurance program that provides benefits to people who are either 65 or older or people under 65 who have a permanent disability. One of the questions we get really frequently is, how is eligibility determined? And I can tell you that Medicare eligibility is not based on income or resources. So Medicare doesn't care how much money you make. They don't care how much money you have in the bank. Eligibility is really based on age or disability, and then potentially paying into the Social Security system, which we'll talk about a little bit later. Next slide, please. So before we dive in to all of the costs and all of the intricate things to keep in mind about Medicare, I want to make sure we're all on the same page about what Medicare covers and what the different parts actually mean. Because for a lot of folks, this kind of seems like alphabet soup. So we've got Part A, which typically covers hospital services. So that's, if you have surgery, you're admitted to the hospital, or you have an accident, you're admitted to the hospital. Hospital services where you're staying overnight, those types of things, that's what's covered under Part A. So in addition to the hospital services, home health care, skilled nursing care in a skilled nursing facility, and hospice care are all things covered under that hospital benefit for Part A. Now, Part B, on the other hand, B as in boy, covers outpatient doctor services. So, your typical, going in for your routine checkups, or you've got a cold and you want to go see your doctor, those types of things are covered under Part B. So a few other things covered under Part B: ambulance services, labs and diagnostic tests, durable medical equipment like a wheelchair or a walker, preventive care, which we'll talk about in a minute, and then other outpatient therapy and mental health services. So traditionally, those were the two main parts of Medicare. And then later, they introduced Part D, as in David, or D as in drugs. So Part D covers prescription drugs. And we'll go into a lot more detail about Medicare Part D, drug coverage, and other assistance programs. Next slide, please. So I mentioned that Medicare Part B typically covers preventive services, and this is not an exhaustive list of what is covered as a preventive service under Medicare. But I did just want to give a brief overview because I think it's really important, obviously, to keep up with preventive screenings. And there are a number of cancer screenings that are covered under Part B where you don't have to worry about out-of-pocket costs. They really want to encourage folks to get those preventive services. So, if you're going to be new to Medicare, you're eligible for a Welcome to Medicare exam. And then every year after, you can get yearly wellness visits for a wellness assessment. There's breast cancer screenings that are covered, cervical cancer screenings, colorectal cancer screenings, depending on your age and other eligibility, free flu shots, and then of course the COVID-19 vaccine is also covered under Medicare. Next slide, please. So now that we've sort of gone over what the various parts of Medicare cover, let's talk a little bit more about eligibility and enrollment. So who is eligible for Medicare? I mentioned this at the beginning, but I really want to make it clear because sometimes we get calls from people on our hotline who say, oh, I'm 50, but I'm leaving my job and I think I might want to enroll in Medicare. How do I do that? Well, that might not be a possibility depending on whether or not they're actually eligible. So typically Medicare is for folks that are 65 or older, even if they are not retired and starting to collect their retirement benefits through Social Security. If you are age 65 or older and you've been paying into the Social Security system, you might become eligible for Medicare at age 65. Or if you're the spouse or former spouse of someone who's entitled to Social Security retirement benefits. And then for folks who are under 65, there's a couple of specific situations that might qualify you for Medicare. The first very common one is for folks who have been receiving Social Security disability insurance, so SSDI, for at least 24 consecutive months, so 2 years. There's basically a 2-year waiting period once you get on SSDI because of a permanent disability before you're eligible for Medicare. And then the other two options that might make somebody eligible for Medicare would be an ALS diagnosis, also known as Lou Gehrig's disease, or end-stage renal disease. Next slide, please. So one of the most important questions is, when do I enroll in Medicare? Because there can be late enrollment penalties if you fail to enroll at the right time, and you can potentially be faced with pretty serious gaps in your health coverage depending on when you enroll as well. So I always like to make sure that folks are very familiar with the various enrollment periods. And so the first one, everyone gets. So the initial enrollment period happens when someone is turning 65, or if they're becoming eligible based on, a disability. Everyone gets that initial enrollment period, which begins 3 months before the month that they become eligible. So whether that's, the 65th birthday month or the 25th month that they're going to have their SSDI benefits. And then it's 3 months after. So it's a 7-month period where you can make decisions about your enrollment. The enrollment typically does take a little bit of time. So they do give you a pretty substantial period to make decisions about your enrollment in Medicare. Now, if you miss your initial enrollment period, you're not totally out of luck. There are other opportunities to enroll in Medicare. So every January through March, we have what's called the general enrollment period. So if you fail to enroll in Part B or Part A, during your initial enrollment period, but you decide the following year that you do want to enroll, you would have the opportunity to do that during January through March, and those benefits would begin on July 1st. Now, there are some certain situations that might qualify somebody for what's called a special enrollment period. where they might be able to enroll in Medicare later outside of their initial enrollment period without having to worry about late enrollment penalties. So I'll talk a little bit about that on the next slide. So one of the most common questions we get, especially these days because most people are not retiring at age 65, right? Especially somewhere like Los Angeles, LA County. It's really expensive to live here. And so a lot of folks are not ready to retire at age 65 or can't afford to retire at age 65. So one question we get a lot is, do I have to apply for Medicare if I'm working and I have employer insurance? So that depends. So for folks who work for an employer who has 20 or more employees, they might be able to delay their enrollment in Part B. So again, Part B, that's that outpatient coverage. So if they are working or their spouse is working and they're covered by that employer health plan and their employer is over 20 employees, they can potentially delay their Medicare enrollment until they or their spouse retires and won't be charged a late enrollment penalty. Next slide, please. Now, it's a little bit different for folks who are eligible for Medicare due to disability under age 65. So if those folks are working and covered under an employer health plan, or more likely if their spouse is working and they're covered under their spouse's employer plan, then they may also be able to delay their enrollment in Part B with no penalty, as long as it's a much larger employer. So if the employer has 100 or more employees, then they might be able to delay their enrollment in Part B without having to worry about a late enrollment penalty. So that's what's called a special enrollment period. So you might be wondering, well, how would that work? Why does that matter? Well, part of why that's important to know is because if somebody has employer coverage and becomes eligible for Medicare, typically if they are covered through current work and then, either their own current work or their spouse's current work, and then they enroll in Medicare, the employer plan continues to be the primary coverage, and then Medicare is secondary. So if you already have a really good employer plan and Medicare is going to be secondary, you might not need those additional Part B benefits and might not want to pay for the additional Part B benefits until you lose that primary employer coverage. Now, the flip side of that is once somebody retires, if they are offered retiree coverage through their former employer, what typically happens is then Medicare becomes primary. So if it's no longer current work, Medicare becomes primary and the retiree plan becomes secondary. So at that point, it would be really important to have Medicare Part B and all the other parts as the primary coverage. Next slide, please. So we've talked a little bit about enrollment and eligibility. Now I want to move into talking about the costs, because unfortunately, one of the things that seems to surprise a lot of new Medicare beneficiaries is how expensive some things are. It's not free coverage for the most part. So I want to make sure everyone's prepared and has a sense of what they could expect to potentially pay. So first, talking about Part A. Now, when we're talking about a premium, we're talking about a monthly, the monthly premium that is paid every month, regardless of whether or not you use the care. So for most people who have been paying into Social Security over the course of their careers and have at least 40 work credits with Social Security, so that's about 10 years of work, but obviously a lot of people have a lot more than that, then those folks become eligible for Part A for free. There is no monthly premium for most people for Part A. Now, if somebody has fewer work credits with Social Security, maybe they have, less work history, maybe they worked for a school district that didn't pay into Social Security, maybe they've immigrated to the United States somewhat more recently and don't have 10 years or more of work experience, then there is a monthly charge for Part A. So if you have fewer than 30 work credits or work quarters, it can be as much as $471 a month to get this Part A coverage. If you have between 30 and 39 work quarters, it's $259 per month. And these amounts do tend to go up each year. Next slide, please. So although Medicare Part A is free on a monthly basis for most people, there are costs associated with actually accessing hospital coverage through Part A. So, some of these costs I'm going to talk about, this is, without any supplemental plans, this is without, any secondary coverage. These are the set amounts that Medicare Part A might charge somebody for these benefits. So for days 1 through 60 in the hospital, you typically pay a first day deductible, which is almost $1,500. And again, these amounts do tend to go up every year. So there are other co-pays that you might have, or co-insurance or co-pays that you might have to pay, if you're in the hospital longer than 60 days. A lot of the time what happens is someone's admitted to the hospital, they're there for a week or two, then they're released to a skilled nursing facility. And at a skilled nursing facility, that's where they might be getting skilled care like, physical therapy or occupational therapy. Days 1 through 20 are covered in full. So, you pay that first day deductible and then you're covered in full for days 1 through 20 at a skilled nursing facility. But if you're there more than 20 days, then you might start incurring additional co-pays. And this resets once there have been 60 days where you have not been admitted to the hospital. So that's why it says coverage per benefit period. Each benefit period is a 60-day period. Next slide, please. Okay, so that was Part A costs. Now we're going to talk a little bit about Part B. So the standard monthly premium, so Part B, again, that's that outpatient, doctor coverage. The standard premium is $148.50 in 2021. I anticipate that will likely go up by another couple of dollars next year. Like I said, we'll know that later in the fall. And high income earners do pay more than this. So if you are a single filing person and your income is over $88,000 a year, you're going to pay more than that $148.50. It is a graduated amount depending on your income. And same if you're a jointly filing married couple and your income's over $176,000 a year, you're going to pay more than that $148.50. If you're married and you file separately, there are other, graduated amounts. So just keep that in mind. But most people do pay the $148.50. And I did want to mention the lifetime penalties because I talked about those special enrollment periods and maybe you don't have to take Part B depending on your other coverage. But for folks that, don't qualify for those special enrollment periods and simply just ignore it and fail to enroll in Medicare Part B on time, there can be lifetime penalties for late enrollment. And those penalties are very steep. So not only are they're something you have to pay for the rest of your life, the rest of the time you have Medicare coverage, it's actually 10% of the premium for every 12-month period that you could have had Part B coverage but did not. So 10% of $148.50 is almost $15, right? And so if you go for one full 12-month period without Part B coverage and then you enroll, you might be facing an extra $15 per month for life. So if you go 2 years without coverage or 3 years without coverage, oh my gosh, $45 per month extra just for the Part B. So you really want to avoid lifetime late enrollment penalties if at all possible. So if you're not sure about your enrollment periods, our agency can help talk you through that. Next slide, please. Now, there are also co-pays and deductibles for Part B. So you pay for Part B on a monthly basis, and then when you do access your medical care, you may have to pay something out of pocket. So there is a $203 annual deductible. So the deductible, again, is how much you pay out of pocket before Medicare kicks in. And then, a lot of folks hear about that 80-20 split, right? So Medicare typically covers 80% of your healthcare costs. You're responsible for 20% of those Medicare approved charges. So let's say you go to a doctor's visit, Medicare approves, it's $100 for the doctor visit. So that means Medicare might pay the $80 of it, and then you're responsible for 20. That might not be so bad if those are what the charges are, but a lot of times it's a little bit less predictable how much 20% of some unknown number is going to be. And then for doctors that don't accept what Medicare pays as payment in full, they can actually charge patients an additional 15%. So that's when, it says unassigned claims. If you want to avoid those excess charges, you should look for doctors that accept what's called Medicare assignment. And that's something that you can search for on the Medicare.gov website. Doctors do say whether or not they accept assignment. If they do, you don't have to worry about excess charges. Okay, next slide, please. So those costs are not nothing, right? $148.50 per month can really add up for folks, especially if you previously had employer coverage that maybe you didn't have to pay for, or if you had other coverage. The $148.50, and if you don't qualify for Part A for free, that can be extremely unaffordable. So there are some programs called Medicare savings programs that are available for folks who have lower incomes and limited savings and property. In order to be eligible for these programs, you do have to have Parts A and B, and the application is processed through the Department of Public Social Services. So in LA County, it's the LA County DPSS office. We also can assist with these Medicare savings programs applications. And on the next slide, I'll talk a little bit about eligibility. So there's 3 programs technically for Medicare savings programs, and I'm not going to go through all of them in a lot of detail, but the first one, Qualified Medicare Beneficiary, or QMB. As you can see on the slide, this program, you do have to have very limited monthly income. So $1,074 as a single person, or only up to $1,437 per month for a married couple. That's basically around this SSI income limits, or supplemental security income. So that's very low income. But if you have limited income and you meet these resource limits, so money in the bank, other property, as long as it's under these amounts, you may actually qualify to have the state of California pay your Part B premium and pay the Part A premium. So I think the QMB program is really, really helpful for folks who don't qualify for free Part A. Again, maybe because they don't have enough work history with Social Security. Maybe they've been out on disability a really long time, out on SSI. A lot of our clients who qualify for QMB are on SSI, but not everybody. But if you qualify for QMB, the state pays both the Part A and Part B premiums, and also pays Medicare deductibles and coinsurance. So if you have QMB, you basically have very, very limited out-of-pocket costs, if any, in terms of your Part A and Part B coverage. Now, the other 2 programs have basically the same benefit. So instead of the state paying for Part A, for the SLMB, Specified Low-Income Medicare Beneficiary, and the QI program, Qualified Individual, you get the state to pay that Part B premium for you. So that $148.50, if that is something that is really going to be difficult for you to be able to afford, it's a good idea to look into the Medicare savings programs to see whether you qualify. And like I said, our agency can help with those applications. Next slide, please. Okay, so moving on, we talked about parts A and B, what they cover, when to enroll, how to get financial assistance. So now we're going to move into Medicare Part D. So that's the prescription drug coverage. And I always like to show this slide to give sort of a visual representation, because I know some folks are visual learners, some folks, are okay with reading a lot of information on a screen. But I think this helps to illustrate the two ways that you can get Part D coverage. The first option on the left is what's called original Medicare. Some people refer to it as fee-for-service Medicare. But basically what original Medicare means is that you have your red, white, and blue card that you get when you turn 65 or when you apply for Medicare, shows your Part A and B coverage. You go see any doctor that accepts Medicare, and then you get a separate standalone prescription drug plan. When you have a standalone prescription drug plan, that drug plan has no bearing on which doctors you see. The only thing it's managing is your prescription drug benefit and possibly, which pharmacies you can go to. So that's one option. Now, the other option is what's called a Medicare Advantage plan. A Medicare Advantage plan is a plan where you have your Part A, B, and D benefits all assigned to a health insurance plan, a private plan. In LA County, they are all HMOs except for one. And so an HMO typically means, you have a limited plan network, your out-of-pocket costs are a lot lower, but you do have to go to a primary care doctor before you can get referrals to specialists. But everything is all coordinated under one plan. Basically, you say, I want to enroll in, XYZ plan, and Medicare pays that plan on a monthly basis to provide that coverage to you. Next slide, please. So this is what we've just sort of talked about. So the first option is a standalone prescription drug plan. You continue to use original Medicare for Part A and B services. You're not locked into any plan network. You can go see whichever doctors you want that accept Medicare. With a Medicare Advantage plan, which some people refer to as Part C, but I don't like to use that term because I think that implies that it's required. And a lot of folks call us and say, well, I need to select a Medicare Advantage plan. I need to select a Medicare HMO. Well, that might not actually be the case. You're not required to do that. It is an option, and it might be the best option for you depending on your situation, but it is not required. So I don't like using Part C. So when you enroll into a Medicare Advantage plan, like I said, you assign Parts A, B, and D all to the same plan. You obtain all of your care through plan providers. And for both of these options, there may be an additional monthly premium that you have to pay, but not necessarily. A number of the Medicare Advantage plans that are offered in LA County do not actually charge anything else besides what you would already be paying for Part B, that $148.50. So, like I said, for some folks, the Medicare Advantage plan makes a lot more financial sense, but we'll talk a little bit more about Medicare Advantage later in the presentation. Next slide, please. So another question that we get pretty commonly, do I have to enroll in a Part D plan? Maybe. So enrollment is technically voluntary, but if you have other drug coverage these are the magic words, creditable coverage. So that means if you have drug coverage that is equal to or better than the standard Medicare drug benefit, you don't have to enroll into a Part D plan. So a really common example of that is if you have employer-sponsored coverage that has Medicare or prescription drug coverage that's just as good or better than the standard Medicare Part D benefit, then you might not have to enroll in a drug plan until after you leave your job, similar to the situation with Part B. Another really common example is folks that have VA drug coverage. The VA has really, really good drug coverage, so most folks that have VA coverage are not required to get into a Part D plan. However, if you don't have drug coverage and you later enroll in a Part D plan, you can be faced with a late enrollment penalty. The late enrollment penalty for not having drug coverage is much less punitive than the Part B penalty. You'll see here it's 1% of the base premium for each uncovered month. And the national base premium in this year is $33.06. So, if you go 6 months without drug coverage, that might only be 6 times 33 cents, right? So that's way less than, an additional $15 per month for life. But it's still a good idea, obviously, to avoid late enrollment penalties if you can. Next slide, please. So when can someone enroll in a drug plan? So just like for Parts A and B, during your initial enrollment period is typically the best time to enroll. You're starting your Parts A and B coverage. If you decide you want to get into a Medicare Advantage plan during your initial enrollment period, boom, there's your Part D coverage. Sometimes folks will kind of forget about that drug coverage if they're not going the Medicare Advantage route. But, the good news is that initial enrollment period is a 7-month period. So if you initiate your Parts A and B enrollment, early in that period, you might still have another 6 months to make a decision about your drug coverage. And then every year, there is something called open enrollment or the annual election period. So from October 15th to December 7th every year, that's when you could make a change or enroll for the first time into a prescription drug plan or a Medicare Advantage plan. Any change or enrollment that you do during that period becomes effective on January 1st. So this is a really busy season for our agency because we do assist with running some of those plan searches for folks. The Medicare.gov website has a plan finder tool. It's not always the most user-friendly, but our agency, we've got some experience doing that. So if you, want to see what your options are, or if you want to confirm whether the plan that you're in is still going to be the best option for you in the upcoming year, I again encourage you to reach out to Center for Healthcare Rights because we provide these services for free and can sort of help. We don't select a plan for you and we don't enroll you, but we can certainly talk you through what your options are. Next slide, please. So in addition to the annual election period and the initial enrollment period, just like for Part B, there might be a special enrollment period that someone might be eligible for based on a major life change that's happened. So one example I gave before is if you lose your employer-based drug coverage, that would give you a special enrollment period to select a Part D plan, even if we're not in the open enrollment period. Let's say you lived in Arizona before and you moved to California and your Part D plan in Arizona no longer covers you in California. You would have a new opportunity. Typically, these special enrollment periods are 63 days. And then there is also, another example, if you enter or leave a nursing home, or if you qualify for Extra Help, which is a financial assistance program I'll talk about in a little bit. There are additional special enrollment periods. Next slide, please. Okay, so let's talk a little bit more about the costs. We talked already that, the monthly premium for a Part D plan, whether it's Medicare Advantage or a standalone plan, might vary. And the annual deductible might vary as well. So some plans eliminate the Part D deductible, or some folks don't have a deductible because they're on the Extra Help program, which again, I'll mention in a couple slides. But the standard Part D deductible for 2021 is $445. And I'm not going to go into a ton of detail about what's on this slide here, but it is important to note that there are various coverage periods for your prescription drug benefit. Now, if you don't really take many prescription drugs and your drugs are all generics and not expensive, you probably won't even need to worry about, oh, am I in the initial coverage period? Have I met my deductible? What about the donut hole? Catastrophic coverage? Those concerns are really for folks that take a lot of prescriptions or have very expensive prescription drugs. We do certainly talk to folks that do enter what's referred to as the coverage gap or reach the catastrophic coverage phase. But the basic thing to know is that, Medicare and your drug plan, they're tracking how much your drug costs, how much you're paying out of pocket and how much your drug plan is paying towards those costs. Once they reach a certain threshold, then you might reach what's called the coverage gap. But in both situations, you're paying 25% of the total retail cost of your prescription. And then once you reach yet another threshold where the total cost of your drugs is about $10,000, then you might reach the catastrophic coverage phase and your copays would go down to a set amount or 5% of the cost of each prescription drug. So you may have heard horror stories about the donut hole in the past. It has improved substantially thanks to the Affordable Care Act. But if you don't take a lot of prescriptions, this might not be something that's really even going to be on your radar. Next slide, please. So obviously, prescription drugs can be very expensive. And so there is a program through Social Security called Extra Help, or the Low Income Subsidy Program. Next slide, please. So the Extra Help program has several different limits and several different levels of assistance. So there's full LIS or extra help, there's partial extra help. So basically, if you are an individual and your income is up to just over $1,600 per month and you have savings just under $15,000, or if you are part of a married couple and your income is just under $2,200 per month and you have about just under $30,000 in savings, you might benefit from the Extra Help program. So your deductible is going to be reduced. How much you pay for your prescriptions at the pharmacy will be reduced. And then once your total out-of-pocket costs reach a certain threshold, you'll have set copay amounts. If your income is even lower, at the top of this slide here, you might qualify for full Extra Help, where you might not have any deductible. Your copays might only be $370 for generics, $920 for brand name. That's for a 30-day supply. And then Medicare might cover the 100% of the costs once your prescriptions reach a certain out-of-pocket amount. So the Extra Help program can be really helpful. It also qualifies you for additional special enrollment periods to make changes to your coverage throughout the year. And you also become eligible for a Part D drug plan that has a $0 per month premium. So for some folks, the Extra Help program can save them thousands of dollars. And that, again, it's run through Social Security. There's a really straightforward application on the Social Security website, and our agency can also assist with those applications. Next slide, please. Okay, so we've talked a bit about, the costs that are associated with Medicare. Part A and B might have premiums. You may have significant copays. There are deductibles. And then we just talked a bit about the Part D premiums, copays, and deductibles, right? Those are all things that you're paying either out of pocket on a monthly basis or each time you're accessing your care or filling a prescription. So that's one way that there are gaps in your Medicare coverage. Now, there are also gaps in terms of certain benefits that are not covered by Medicare. And so I'm just going to go through the examples on this slide here because some of it is a little surprising. I'll never understand why the US healthcare system treats our teeth like they are not parts of our body, but dental care is not traditionally covered by Medicare. Now, some Medicare Advantage plans might include some dental coverage. We'll talk about that in a little bit. But traditionally, dental care, routine podiatry, eyeglasses, hearing aids, incontinence supplies, transportation to medical services, and then this last one, which is very expensive and very important for a lot of aging folks, is custodial nursing home care or personal care services at home, like in-home supportive services. So none of these things are traditionally covered under Medicare. And so a lot of folks contact us saying, look, I can't afford this, or I need access to these benefits. What can I do? So now we're going to talk a little bit about how to supplement your Medicare coverage to help cover some of these copays, deductibles, premiums, etc., and also potentially get access to some of these other benefits. Next slide, please. Okay, so I know this slide I both love and hate because it's reminiscent of the slide I shared earlier where we had original Medicare on the left and Medicare Advantage plans on the right. So now we're going to dive a little bit deeper. So on the left, we've got original Medicare, right? You've got the red, white, and blue card. You enroll in a standalone prescription drug plan. However, as we just discussed, you might have copays for your Part B. You might have that Part B premium payment you're paying for your drug plan. If you really want to avoid significant out-of-pocket costs, if you go this route for original Medicare, most people do end up getting some sort of supplemental coverage. So either your income and savings are low enough to qualify you for Medi-Cal, and I'll talk a little bit about Medi-Cal in the next couple slides. Medi-Cal covers all of those copays and deductibles. So having Medi-Cal as secondary coverage is a great way to supplement your Medicare. You might have heard the term Medi-Medi or dual eligible. That's what that refers to, where you have Medicare and Medi-Cal. Now, for folks who don't qualify for Medi-Cal, but do want to go this route where they have the most flexibility to see whichever Medicare doctors they want, they've got the separate drug plan, those folks might try to purchase a Medicare supplement plan, also known as a Medigap. So those help pay for parts A and B copayments. I'll talk about those in the next couple slides as well. Now, the other option, as we've already discussed, is a Medicare Advantage plan. So maybe you don't have income low enough to qualify you for Medi-Cal, maybe a Medicare supplement plan is too expensive for you, or maybe you just like the HMO model. Because in LA County, like I said, they're all HMOs except for one. These plans, provide the parts A, B, and D benefits all together, and they have set copay amounts for the most part. So instead of wondering, okay, well, what's 20% of, some unknown number? How much am I going to have to pay for all of these different benefits if I go to the hospital, if I go to this, I go to that? The Medicare Advantage plans probably look a little bit more like coverage that you would have had through work or some other private insurance plan where there are set copay amounts. And some of them, as I mentioned, also provide additional benefits like dental, vision. We get a lot of calls from folks who say, oh, I heard I can get a free gym membership if I sign up for Medicare Advantage plan. They do offer some additional supplemental benefits. So again, if you are not sure about your options, need assistance searching for plans and trying to compare plans, that's something that our agency can certainly help with. Okay, next slide, please. So first, let's talk a little bit about Medigaps. So a Medigap plan is a private insurance plan that pretty much just is there to cover your copays and deductibles. So if you want to go the original Medicare route and have flexibility about which doctors you want to go see, signing up for a Medigap will have no impact on which doctors you can go see. There are no plan networks. It's just, did Medicare pay their share? Yes. Then the Medigap will pay its share afterwards. It's your secondary coverage. They are standardized plans that have to meet certain requirements. It's more alphabet soup, so they have letters A through N. And some of them have a foreign travel benefit that covers medical care received outside the U.S. Medicare typically does not cover you outside the U.S., so that might be an important consideration. And the other thing that I like to mention about Medigaps is that if somebody spends a lot of time in other parts of the country, like let's say you have a son or a daughter or a family member that lives in Pennsylvania and you live here in California, but you spend 3 or 4 months out of the year in Pennsylvania, you might want to have the flexibility to see any Medicare doctor and have, this type of secondary coverage. Whereas a Medicare Advantage plan typically only covers, emergency care if you're outside of the county where you live. And so these Medigap plans are regulated by the California Department of Insurance. There are standard rate surveys on the on the California Department of Insurance website. So if you want to get a sense of how much one of these plans would cost you, you can look that up, or that's something that we can also help with. Next slide, please. Okay, so when can you enroll in a Medigap plan? Typically, the first 6 months that you have Parts A and B coverage is the best time to do it. They can't do any medical underwriting, so they're not asking about pre-existing conditions. They're not charging you more. That is when you have a guaranteed issue right to purchase a plan. There can be other circumstances where you will also qualify for a guarantee issue right to purchase a plan, but typically, the least hassle is when you do it during the first 6 months of your Medicare coverage. They can have waiting periods, but like I said, there are other specific qualifying events that might allow you to purchase one outside of that period. Next slide, please. Okay, so now we're going to move on to talk a little bit about Medi-Cal. So I mentioned that Medi-Cal can be a really great way to supplement your Medicare coverage if you have lower incomes and limited savings. So if you receive SSI, that supplemental security income, you automatically get Medi-Cal. I actually just talked to somebody recently who didn't realize she had Medi-Cal. She just became eligible for Medicare, didn't realize she had Medi-Cal also because she receives SSI. So if you don't receive SSI, you might qualify for Medi-Cal if you're over 65 or have a permanent disability. These are the current income limits and resource limits. So if you're single, if your income is under $1,482 per month, married income under $2,004 per month, and then really limited property or savings. They don't count the house if you own a house or the car that you drive. So this is really more in terms of money in the bank and savings. Next slide, please. So how do Medicare and Medi-Cal work together? So, just as we said before, Medicare is the primary insurance coverage and Medi-Cal is secondary. So if somebody qualifies for both Medicare and Medi-Cal, so they're Medi-Medi or dual eligible, Medi-Cal pays the Part B premium, so they automatically qualify for one of those Medicare savings programs. And then they also automatically qualify for extra help, that prescription drug assistance program. And their copay amounts, if you have Medi-Medi, the copays with extra help are even lower than what we had talked about on those previous slides. So you might only pay $1.30 for a 30-day supply of a generic drug and $4 for a 30-day supply of a brand name drug. So that can be a huge cost savings. And then also, if you have Medicare and full Medi-Cal, you cannot be billed for Part A and B, copays or deductibles. So if you have both Medicare and Medi-Cal, you should not be receiving bills for Medicare covered services. That's called balance billing. And that's also something our agency can assist with in terms of, talking to the providers and trying to make sure that folks get refunds if they have paid, for things that they shouldn't have been billed for. So again, that's one of the other things our agency can help with. Next slide, please. So one last thing that I want to mention, especially as we approach, the open enrollment period or the annual election period, Medicare marketing can be pretty aggressive. So I want to make sure that we're all clear on what is appropriate, what you do or don't have to do, what agents should or shouldn't be doing. Medicare marketing scams do target folks year round. So a couple things to keep in mind. Do not respond to offers of free medical equipment or services. We've talked to too many people who have, answer the phone, said, oh yeah, sure, here's my address. And then they, open a box on their doorstep that has a knee brace in it that they never wanted. And it turns out their Medicare was billed for it, even though it's not something that's an example of fraud. It's a good idea to check your medical statements to make sure that, you're not being billed for services that were not actually provided. Please beware of insurance agents pressuring you to switch plans. If I had $1 for every client I have spoken to who has contacted us because they were misled by an agent who told them, oh yeah, your doctor's in this network, I can get you these additional benefits, and then they switch and it turns out their doctor doesn't accept that insurance, that would be a very wealthy woman. So, if you're concerned or if you're not really sure, if you're thinking about switching plans, again, it's a good idea to reach out to us. We can provide sort of unbiased, neutral information. We don't get any commissions the way that agents might. So they might have a reason for trying to switch your coverage, even if it's not the best option for you. We can certainly talk you through some of that to see, if it is a good idea for you to switch coverage or not. Plan agents are not supposed to conduct marketing or sales activities at educational events. They should not be going door to door. They shouldn't say that they're calling on behalf of Medicare. You shouldn't be getting unsolicited phone calls. And then the really important one that I just mentioned is they should not be providing information that is inaccurate or misleading. So if they're telling you your doctor isn't network and that's not true, you might have a reason to file a complaint and, get out of the plan that they've switched you into. So again, if that's a concern, please contact our agency. So with that, I think I am just about done here. I wanted to share our phone number and our website one last time. If you need additional assistance understanding Medicare or Medi-Cal and you have questions that come up, please feel free to give us a call and schedule an appointment to speak with a registered Medicare counselor. Again, all of our services are free. 1-800-824-0780. You can also visit us online at healthcarerights.org. So thank you so much for your time and attention, and we hope to hear from you.
Thank you, Stephanie, for that informative presentation. As I mentioned before, we hear so much about Medi-Cal because we live in California, but that often comes at the price of being more knowledgeable about Medicare. It is important to understand that Medi-Cal and Medicare are two parts of a system that work together instead of separately. Thank you for joining me today as we learned about Medicare insurance benefits. And a very big thank you to Stephanie for her wonderful presentation. As I mentioned at the beginning of this video, the USC Family Caregiver Support Center is here to help educate you, connect you to resources, and support you throughout your caregiving journey. Please be sure to visit us at www.fcsc.usc.edu or visit our social media pages on Facebook, Twitter, and Instagram to learn more and connect with our center. If you enjoyed this video and found it helpful, please click on the like button below. Also, make sure to click on that red subscribe button, also below the video, to subscribe to our YouTube channel and be notified every time we post a new educational video for the caregiving community. Take good care of yourself, and until next time, just remember that caregivers fight on.